So today I want to talk about one common concern or complaint that we get here in the clinic a lot is back pain when sleeping or back pain when lying in the bed, specifically back pain with lying on your back. And I want to give you one exercise that you can do that should start helping immediately. So first off, why does this happen is a lot of times the muscles in the front of the hip become tight, and what it can do is change the way the pelvis is aligned, and your pelvis is connected to your spine. And so when the pelvis is aligned a little bit differently, and specifically it's called rotation, but when it's aligned a little bit differently because muscles are pulling it in one direction, because it's connected to the spine, it can align the spine a little bit differently. And so oftentimes when people say, my back hurts while lying on my back, it's a sign that there's some tightness in the front of the hips. So let me give you one thing that you can start doing immediately that can start giving you some relief. So Camilla is a prime example of somebody that has a little bit of low back pain when she lies on her back. And what we need to do with her is loosen up the front of the hips in order to get her feeling a little bit more comfortable. So what we're going to do is I want you to go ahead and put your knees up, and all you're going to do is a simple bridge, and you're going to bridge up. Do you feel that into your lower back? Yeah. And she says, yes, I feel that into my lower back when I bridge up. Now this exercise you should not feel into your lower back. That's a sign to me that says you're overusing your lower back. Now, I know the majority of the time people that have pain, the reason they're in pain is because the area is overworked. So with a simple movement like this, I know her lower back's overworked because she feels it into her lower back with a movement that shouldn't be causing the lower back to do much work at all. So what we're going to do is we're going to force her core, and we're going to force her glutes, the butt area, to work in a proper movement in order to get the front of the hips and the low back not to just loosen up but feel better. So if we take a band here and we put it around her knees and then just lightly press out against the band, and I want you to go ahead and bridge up again. Does that feel better?
Yeah, it feels different.
It feels different. So do you still feel into your lower back?
No, not as much. I feel on my glutes.
Yeah, feel more into the glutes, less into the lower back. So again, what this band is doing is it's forcing the glutes to work, and the core, which is taking load away from the back. So it's not necessarily about strengthening the glutes and the core. It's about retraining certain movements that should cause the back to say, hey, we don't need to work hard within this movement. So we're retraining movement. We're not saying we need to retrain strength. We need to retrain movement. Certain areas should be working with certain movements while other areas aren't. And so go ahead with this exercise. If that's you, if you feel it into your low back, I want you to take a band. You're going to pull out. You're going to press up and do about 10 to 15 of those bridges. Once you feel like you're not having it into your low back, I want you to take the band away, and I want you to bridge up again. And it should feel similar without the band as it did with the band. And that's when you do another 10 or 15. Does that make sense?
Yeah.
And do another 10 or 15 without the band, as long as it feels the same with the band. Now, if this is you and it just won't come out of your back, it doesn't matter if you put the band on the knees, you bridge up, you still feel it into your back, that likely means we need to do some stretching on the front of the hip. So let me give you a simple stretch that you can do before going into the bridge. Okay, so again, if you tried the bridge, you tried it without the band first, you felt it into your low back. You tried it with the band, you still felt it into your lower back. That likely means you have some really tight hips in the front that we need to start stretching first and then go into that bridge exercise with the band. So a simple stretch that I want you to do at home is, Camilla, if you would, go left knee down here, right foot is going to be in front, and you can use a chair in front of you. I would recommend you use something like, Camilla, go ahead and hold on to the wall. You're going to want to balance yourself with your arms. Because if you don't use your arms to balance yourself, the muscle won't stretch because it's too busy trying to keep you upright. And a muscle that's trying to balance you won't stretch at the same time. So left knee's down, And then all I want you to do, Camilla, is you're going to essentially open up that front of the hip by pushing forward a little bit. Now be careful not to move at the spine. The only area you're moving is that hip. And you should feel a little bit of a light stretch. It feels kind of deep in the front of the hip. And then go ahead and hold that 30 seconds, a minute, somewhere in there. And then switch and do the other leg. And then after you do that stretch, I want you to go back to the bridge, try the bridge again, and see if that feels better.